Are steroids really that dangerous? Are they as dangerous as everyone says they are? Well, I'm not going to answer this question in a one-word sentence. I'm going to look at a study and we'll go through this and you can come to the conclusion yourself. I'm going to show you a study that looked at over 100 steroid users, that examined them before, during, and after their cycles, that even looked at their blood work and all health systems, and then compiled all the data together to give a consensus on the safety of steroids. Hi, I'm Dr. Downey, and I just want to go over this Harlem study with you. It's quite a revolutionary article because a lot of the side effects or dangers of steroids tend to be from case reports or anecdotal reports online. And now we have finally got a published, reviewed paper on almost all the possible negative and positive side effects you could experience from a steroid cycle. So again, this is the study that I'm referencing, and I'd like to thank the authors of the study for sending me this paper. It was just released. They have released previous reviews on their data as they collected it. And some of you may remember this study because it was one of the studies that showed that steroid use did not cause infertility or permanent infertility. But let's just go over all the data there is, and you guys can come to your conclusion on whether or not you think it's worth using steroids. I'm not going to influence it. Obviously, I don't condone the use of steroids as they're not inherently safe, and using nothing is better than using something, but I'm not here to preach. So all we know is that androgen use does affect health negatively in some way, but we don't actually have that much data on all of its adverse effects. A lot of its side effects just come from case reports and anecdotal reports. But in this study that was conducted from 2015 to 2019 on over 100 users of steroids, they measured a variety of outcomes and blood markers, and these were taken before, during, and twice after every one cycle, so that they could see the acute effects of a cycle. Obviously, there's a problem in this. The sample size isn't that big, and there are ethics issues around that, and that's probably why the sample size isn't so big. And the issue with controlling intake of other explicit substances that could skew data. Furthermore, this study is more on the acute effects, and we don't have any data on long-term effects from studies. So just to give you general background on the participants in the study, their cycles tended to be 13 weeks in duration. Most of the cycles contained at least 4 different androgen types, so it could be testosterone with DECA, something like that. And the median weekly dosage was around 1 gram or 900 milligrams of androgens. So they also did measurements during the PCT, just for those who are curious. So to get it out of the way first, there were 4 serious adverse events. There was heart failure, acute pancreatitis, exacerbation of ulcerative colitis, and suicidal ideation. None of these could be linked to the steroids directly. The case of heart failure was in an individual with hereditary hypertrophic cardiomyopathy, and the previous conditions or serious events were known to the participants prior to starting the study. So quickly, let's look at the common side effects, and let's start with the positive. So surprisingly, an increase in muscle mass wasn't experienced by everyone. Strength was experienced by all participants, or an increase in strength, but an increase in muscle mass was experienced in around 95%. Some reported an increase in energy, and others reported an increase in concentration. So just ability to focus. The more common negative effects were fluid retention, quite a common side effect that steroid users mention. Around half of the participants got it, so just water retention, painful injection sites, and sweating excessively. On examination of the individuals, acne wasn't as common as many people think. Everyone thinks you get acne when you use steroids, but it was actually about 1/3. And in terms of gynecomastia, about 20% had gynecomastia. What's interesting to note though, the positive effects of the steroids quickly disappeared, and this is when what the researchers called a steroid dip. Essentially, after the cycle, around more than half of the participants experienced a decrease in libido, and around 15% experienced erectile dysfunction. These two symptoms are probably the most common reason why people prefer to blast and cruise, so they don't experience that steroid dip. So let's look at the side effects on your kidney and liver. So there were small changes to your creatinine, which is important in calculating your eGFR or filtration rate and kidney function. In fact, a lot didn't have skewed creatinine, and if they did, it returned to baseline almost after stopping the steroids, and the increase is most likely due to the increase in muscle mass. Furthermore, concurrent creatine supplementation can increase creatinine slightly. So what they concluded from that is there were minimal effects from the kidneys. Obviously, kidney biopsies and such are more preferable. In terms of your liver, there were small increments or increases in your transaminase, such as ALT and AST, which sometimes indicates a bit of damage or minor damage to the liver. And if it is a rather small elevation, then it is more likely to be related to your heavy workouts. I've explained this in another video before, but an increase in ALT specifically, since it is found in muscle, could just be from your workout. If the increase is very pathological, so around 3 times the normal range, then perhaps it is a drug-induced liver toxicity. That wasn't noticed in this study. And no participants, even those using high doses, had considerable nephro or hepatotoxicity, which is kidney or liver injury. Now let's look at one of the more interesting parts, which is the testicular function. Of note, every participant experienced complete suppression of the HPTA, and of course this led to a decrease in testicular volume, and spermatogenesis decreased, which is just creation of sperm. In fact, 3/4 of the participants had a total sperm count less than 40 million sperm, which is considered oligospermia, and then 1/4 of them had azospermia, so no sperm. And of note, a longer duration of androgen abuse wasn't associated with a higher degree of suppression or spermatogenesis, so it's more individual dependent. And once stopping the androgens, there was recovery in 90% of the participants after 3 months, and 100% at the end of follow-up. So yes, it does suggest that every individual, although they were all suppressed, did return to normal function eventually. However, they go on here to note that 37% of the subjects had abnormal gonadal function at baseline, and in these individuals who already had abnormal testicles or functioning testicles, their rate of recovery was much slower, and 24% of these individuals failed to reach their normal testosterone or baseline testosterone concentration at the end of follow-up. The important thing to note, though, is of these 37% of individuals who had abnormal testicular function at the beginning, a lot of them were long-term steroid users, meaning that long-term steroid use could perhaps predispose you to this abnormal testicular dysfunction, and then thus predispose you to have poor recovery from steroids. It's important to note that they noted that spermatogenesis, or the production of sperm, took a lot longer to recover than the production of your testosterone. The time it took for individuals to reach their normal sperm count was around 60 weeks. The time to recovery for testosterone was much shorter. So it's important to note that this would mean you'd have to wait over a year before restarting another steroid cycle if you want to ensure your testicular function is not compromised. Because if you don't wait over a year, your spermatogenesis hasn't gone back to normal, and then you're insulting it again by giving it more androgens. And this can result in testicular dysfunction over the long term. So let's look at the cardiovascular side effects. It's important to note that the incidence of hypertension or high blood pressure is high, and it was established to be high in this paper. 41% of the participants developed hypertension. And if they didn't, all of them experienced an increase in blood pressure from baseline. Another important side effect is an increase in hematocrit, and that was experienced by 1/3 of the patients, so it is common. And the issue with having a high hematocrit is that long-term high hematocrit predisposes you to cardiovascular events and to the formation of clots such as DVTs. Another interesting thing is that there was no dose-dependent increase in blood pressure, so the higher your dose was, it didn't necessarily mean the higher your blood pressure was. And again, this is more individual dependent and depends on your baseline. If you already have high blood pressure at baseline, it's not advisable to use steroids, as this could increase even more. However, on stopping the steroids, it reversed back to its normal levels. As we all know, steroids skew your cholesterol and lipids. The individuals using oral steroids, though, experienced the worst change in lipids. And in fact, some of the individuals from the injectable group experienced positive changes in their lipids, such as a decrease in bad cholesterol, or LDL cholesterol. So let's see how it affects your heart structure and function. There was a clear increase in left ventricular mass in the participants. This has also been shown in another cross-sectional study where they performed an echocardiogram on individuals using steroids. In addition to this increase in left ventricular mass, or LVH, there was a decrease in ejection fraction, which can become a problem if the ejection fraction decreases by a large degree. In addition, the left ventricle became more stiff. However, what was noticed is that on stopping the steroids, these changes returned to baseline. So in terms of long-term exposure, we don't have data as of yet. And we can't truly say what the role of androgens or steroids have in the development of heart disease, since there are so many other causes of heart disease. But from the author's recommendations, they said that if they were to have a patient that was insistent on running a cycle, they would only advise one cycle every 1 to 2 years. And this goes off the recommendation of waiting for spermatogenesis to recover. So in summary, that's all the data there is on the side effects of steroids. This is all the data we have so far, and I'm not going to draw any conclusions for you. I'd like you to look at the research. I'll link the article below and come to your own conclusions. I just wanted to present the data and dispel a few myths that are sensationalized by articles and some doctors, and put real information out there on the incidence of certain adverse effects on steroids. And as we see, most effects from steroid use are acute and do return to baseline, but remember, we don't have long-term data as of yet. So let me know what you think in the comments down below. Let me know if you enjoyed the video, what you thought about it, and I'll see you in the next